Deep into the night, it's just not fair to call it morning yet, a backstretch worker's day begins. By every means of conveyance they come in the pre-dawn hours, 7 days a week, no matter what the weather, on holidays, and yes, even holy days. They come to work as the caretakers and custodians for the most expensive animals on earth. If you are looking for a definition of hard work, look for it worlds away from the glory and the pageantry of the afternoon's races. Look for it at dawn under the shed rows at Belmont, Aqueduct, or Saratoga. It's not glamorous work, the preparation of a thoroughbred, but it is physical work, precision work, skilled work, important work. One simple mistake can turn a stakes winner into a retiree. It's not lucrative work, but it is loving work. The morning rituals of soap and water, the vigor of exercise, the grooming, brushing, bandaging, and devoted detailed attention of the backstretch worker are the foundation of an entire industry. Look for the definition of hard work in workouts when a 1,000-pound racehorse wants to pull you out of the saddle. Look for the definition of hard work in the eyes of a backstretch worker, and you see that it is a labor of love. The horses are well cared for, but who takes care of the people that take care of the horses? Meet Kate Dolan, president of B.E.S.T.
The Backstretch Employee Service Team was incorporated recently to provide comprehensive health and human services to barn area workers. It's an elegant program that pulls together a bunch of different approaches, low cost, if any cost, to the backstretch workers. When a worker comes to us, for instance, who has hypertension or diabetes or asthma, all three of those being common afflictions in the backstretch, we can help them. We would send them immediately to our primary care clinic here in Belmont or up in Saratoga during the season. And if there is additional help that's needed for that backstretch worker, the clinic will refer them to our health benefits plan, out to specialists in the community, orthopedists, cardiologists, all of those specialties. Our professional staff are not only credentialed, but they are bilingual.
There's a broad range of problems that come into the B.E.S.T office. Mainly the problems are related with alcohol and drugs, but we also see crises that occur in families.
The B.E.S.T program has been creative in tailoring the different needs of the backstretchers to their individual counseling, family counseling, or couples therapy.
The people in the backstretch know that B.E.S.T really cares for them and that we will do whatever it takes to help them in any way that we can, whether on-site or off-site if needed.
We have the recovery dormitory, and it's a very important place for people that wants to maintain their sobriety. It is a structure to provide a support network inside and outside.
B.E.S.T helps elevate the lives, indeed sometimes saves the lives of backstretch workers. The community that toils in the backstretch has the same needs as any other community. Working people get sick. Working people need marriage counseling. Working people can get depressed or have drug and alcohol problems. New York racing has produced many heroes over the decades. Here are the stories of 3 more heroes, able to tell their stories today because of B.E.S.T.
Soy una persona asmática y conocí la agencia B.E.S.T in Saratoga en una crisis.
I got to know B.E.S.T for the first time in Saratoga when I had a severe asthmatic attack. B.E.S.T provided me with transportation, translation, and medical help, and because of B.E.S.T's support, I made it through the crisis. Now I am at Belmont, where I continue to receive medical follow-up through B.E.S.T. Thanks to its backstretch clinic, I can keep working.
That's the best clinic I've been to at the B.E.S.T. clinic, and they took really good care of me and made sure I got all the medication I needed and all the follow-ups. And then I wound up going to the hospital after they found out that I couldn't breathe. I almost passed out one day, and I couldn't get my breath. Just a miracle that that I came to B.E.S.T and they helped me out, and especially Kay and Stephanie and my counselors. They was there at the hospital with me every step of the way, and guided me through everything I needed, and they still there for me. And without the program, I wouldn't made it at all. I recommend it to anybody to get some help if they need it, because that's the best thing ever happened to me in my life. I got a second chance.
September last year, I was really struggling with my addiction, which was alcohol and cocaine. And basically, B.E.S.T saved my life. They advised me to go into a rehab in Queens, and I became willing and did that. And today, my life is wonderful. I ride as a jockey and work for Mr. Jerkins here in the backside. And Mr. Ray Maldonado played a big part in helping me continue my sobriety. Without them, I don't think I would be here today.
Please consider making donations to B.E.S.T at Belmont Park, 2150 Hempstead Turnpike, Gate 6, Cottage 28B, Elmont, New York 11003, or call 516-488-3434.